Neighborhood Health Watch is sponsored by the doctors of HCA Virginia.
Well, today kicks off Breast Cancer Awareness Month, and most of you probably know someone who's had breast cancer or might be struggling with it yourself. Early detection is key in fighting this disease, and annual mammograms are the best bet for most women. And here to talk about this new technology in breast imaging is Dr. Nicole Kelleher, a breast imager at HCA Virginia. Thank you so much for joining us, and welcome.
Thank you.
What are the guidelines for mammograms, and who should have mammograms?
Diane, this can actually be a very confusing topic for some women because of differing recommendations from different organizations. But the American Cancer Society continues to recommend that women have their annual mammograms beginning at the age of 40. This is for the general population. If a woman has an increased risk for breast cancer, then screening should start sooner.
Now, this new technology, 3D imaging, how would the patient benefit from having this done?
So 3D mammography, which is also known as digital breast tomosynthesis, allows the radiologist to actually look at the breast tissue in 1 millimeter thick slices, allowing us to separate out the normal tissue that may be overlapping small cancers. So it actually has been shown in combination with 2D mammograms to improve detection of cancers. And the other awesome thing is that it decreases the need to bring patients back for extra pictures, which you can imagine reduces quite a bit of patient anxiety.
Now, would the 3D mammography replace the 2D, and will the patient experience anything different? Will it feel any different?
Believe it or not, there's not that much of a difference to the patient. The patient is compressed in the same manner. The positioning is exactly the same, with the main difference being that the X-ray tube moves in an arc across the breast, acquiring images, versus in a 2D mammogram, it's actually stationary. But to answer your other question, at this point in time, we do not feel that it's going to replace it, but we don't know yet. It's still pretty early.
And where are some of the places a patient interested might be able to have that done?
Within the HCA system, a patient can actually have a 3D mammogram at no additional charge to their two-dimensional mammogram.
That's interesting to know.
Yeah.
No additional charge.
No additional charge to the two-dimensional mammogram at Johnson Willis, Henrico Doctors Forest, and Hanover Emergency Center.
All right, Dr. Kelleher, thank you so much for joining us and sharing with us that new information. We appreciate it very much.